How
Okay,
you
we're all
doing?
set.
Oh, great. Okay, everybody, welcome. We really excited that you are here. This is not an ordinary Zoom action activity. This is a real action day, a real action event. So if you have close to you in your home some paper and markers, please have them ready because we're gonna be doing some stuff later on. Um, so I'm gonna start with a little chant, and the chant goes this way: what do we want? And the answer is vaccine equity. When do we want it? Now. So let's do that. What do we want?
Vaccine
Vaccine
equity.
equity.
Vaccine equity.
And when do we want it?
Now.
Yes, what do we want?
Vaccine
Equity.
equity.
And when do we want it?
Now.
8. Chants are challenging in Zoom, but we did it. I'm gonna pass now the microphone to Russell, and he's gonna talk to us about why we are here right now.
So thanks for joining us, everyone, and thank you, Likia, for getting us fired up. We might want to do maybe another round of chant here in a bit, but welcome everyone. I'm sure that most of you know why we're here. Today, we are extremely concerned that the governor has changed the prioritization system for people with disabilities who are high risk, and really kind of given a lack of clarity as to where we now fall in the prioritization system for the vaccine, COVID-19 vaccine. And we are demanding that situation change. We know that they have the power to set a new structure for priority. We have no issue with reprioritization. However, we need to be seen as valued in the new prioritization, because what we've heard is that a lot of the equity that's currently built in will be maybe slipping away in favor of just an age-based equity system, which we know does not actually cover people who are high risk and very vulnerable to COVID. So we're not asking to be put in front of other groups. We just want to be seen as high risk and be seen in the prioritization at the top of the prioritization list, especially for folks who are high risk. Now, that doesn't necessarily mean our entire disability community. It means people who live with CDC identified conditions that make people more vulnerable to the severe effects of COVID, and also those who are unable to shelter in place due to reliance on caregivers or in-home supportive services workers, and just in general are not able to quarantine even when it's necessary. So the goal here today is that we need to dial up the pressure. There are 82 of us here on this Zoom, so I feel like we've got a good social media army that we can start mobilizing right now. There's no real clear, you don't have to wait for us to give you the signal. We're going to put the toolkit that we have in the chat, and that's your go-ahead to spend a little bit of time, share your story, and use the identified hashtags here that we're using: high risk CA and hashtag nobody is disposable. And we're going to spend some time connecting with all of you. And the goal today, of course, is to push to make sure that high-risk people of all ages get access to the vaccine and are seen in the priority system. And I'm going to turn it back over to Likia, and I'll pick back up in a bit.
As Russell was saying, we don't want just that people with disabilities, all of them, go and take the vaccine first, or any other preference like that. What we want is equity. And so, again, what do we want? Vaccine equity. And when do we want it?
Now.
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 Yeah, so I was talking to one of our members. She is 86 and she has COPD. Is that how you say it?
Mhm.
And she said she called Kaiser, and Kaiser said they don't have it yet. They don't have a vaccine for her yet, and they don't know when. And so this is a person with different conditions, not just COPD, that makes her high risk. And still, she's not able to get it. So what is happening in California seems things are doing, it seems to be doing better in other states. So this is a very important month also. And we want to recognize that we're talking about, is the African American History Month, and these are some of the groups that are more affected by COVID. So in recognizing that, I want to pass the microphone to Nikki Brown Booker, who's gonna talk about the impact in her community with the vaccine issue also. Nikki, are you?
I'm here. Thank you
Okay.
so much.
Go ahead.
So, I am part of a couple of different groups. So I'm a member of Hand in Hand, the Domestic Employers Network, and I'm program officer for the Disability Inclusion Fund. And I'm half Black, half Filipino, and definitely am immunocompromised. I have rheumatoid arthritis, which is an autoimmune disorder. And so, and I also am an attendant user. So I have 6 attendants who come into my home regularly. One of which I've had 2 attendants that have had COVID scares in the last month or so, and which is really scary for me, because then if one of them gets sick and then passes it on to me, then I could pass it on to the other 5 attendants, and then they are all working for other people with disabilities in the area, so then they could pass it on to them. So it's like this big, the as it is with COVID, it just gets passed around and passed around and passed around. And I don't want to get anybody sick. My attendants are being very careful. They don't want to get anyone sick, and they don't want to get me sick. They have been fortunate enough to be able to get all of them have gotten their first vaccine, but yet I'm not able to get a vaccine because I'm not a healthcare worker, and I'm not a senior. On top of that, my mom is 88 years old, and I have not been able to get her vaccinated either. She's a Kaiser patient, and I've checked. I've called her doctor. I've checked the Kaiser website, and they just keep saying she has to wait, and she's 88 years old and a person of color. So this is really a dire situation, I feel, for my community in particular, not just because I'm a person with a disability, but also because I'm Black. And I've had family members that have become sick. I've had a cousin's mother-in-law recently passed away from COVID because they weren't able to get because they lived in a poor Black neighborhood, and they just didn't have the health care needs that they needed. They couldn't get access to really good health care. So, you know, we're in the Black History Month, and there's been a lot of concerns about vaccines, about the science around vaccines, that they haven't, what that people are scared that the vaccine came out too soon and that it may not be safe. But my feeling is that if I don't get vaccinated, then I'm I would much rather take the risk of getting the vaccine and not dying from COVID than have risk that the vaccine is not safe. 'Cause I feel that it is safe just because there's been so many people that have been vaccinated. And I just don't understand why Governor Newsom is trying to change the priority because um like I said, I'm really at high risk and all the people around me are at high risk. And there should I feel like the 58-year-old stockbroker white male in San Francisco might have a chance of getting vaccinated before me, who is like in their 50s who's severely immunocompromised. So that's my I'm really wanting to I've called the governor already. I've sent an email. I encourage everybody to do whatever you can to make this happen because it really has to change.
Um, yeah, it really has to change. And I wanted to call on all of you and see if you can please make your own sign if you want to, or share the one that Russell already shared with you. And I'm gonna pass the microphone to Russell now. Russell?
Thanks. So as you can see, this is an issue that affects so very many of us, and it is important to know that those of us living at various intersections affect this more profoundly. People who are in historically discriminated communities, people who are poor, people who are higher weight or the fat community. All of these communities are experiencing immense levels of discrimination right now. And so it's really important that we acknowledge and take this time to build solidarity together, that we are advocating for all of us, and that we are just asking for equity. It's the equity that we need, the equity that we deserve. And I think Nikki, called out one of the situations that we're seeing is because there's a lack of direction, we're seeing a lack of equity. Counties are just kind of operating in their own fashion, and it's not working. So we need to call upon the governor now to go ahead and take that step, take more direct action from the state, and also to see a clear system of prioritization that does reflect the equity that the state has actually committed itself to in this process from the beginning. Next, I would like to introduce our next speaker, who is Hector Ramirez. Is Hector with us?
Russell, I think Sarita is ready next.
Oh, Saritha. I'm sorry, Saritha Nolan.
Thank you so much. I made my little flyer, if I can get my iPad to show it, because disabled high-risk students deserve the vaccine. We're trying to learn here in the University of California and throughout our state, and we're already dealing with ableism. Being Black and disabled, I deal with ableism, racism, and now I deal with wondering if my life truly matters to our governor. And by his actions, it seems like it doesn't. We really need to make our voices heard, to protect our students who are the leaders of the future, to be there. Because if we let this vaccine strategy go on age-based, when are they ever going to get to a 35-year-old high-risk individual? Will it be before my life is at risk? Will it be before other lives are placed at risk? I am here as the first underrepresented student officer for the University of California Student Association to represent disabled students because we need our voices to be heard. We need our lives to matter. We need to be seen as diversity because really, if you let this, if our governor lets this vaccine strategy stand, it just shows that we stand for nothing to him. And I'd love to have another chat, y'all. So what do we want?
Vaccine equity.
When do we want it?
Now.
And especially now, we need to make this change together. We need to stand together as a community because we see what Crip the Vote did and how we were able to get into a safer president who is disabled himself. In this age, when we have a disabled president, we shouldn't have disabled people dying and placed at higher risk. We should matter. It is time for eugenics and ableism to end right here, right now. And thanks for letting me have time.
Thank you, Sarita. This is good. We are here because we want justice. And so we know that that the governor and all of them can do better, right? So let's try this. Can we put in the chat the phone number of Steve Calle? And can we make the phone call right now? Can we all get our phones and get it ready to make a phone call? Let's do this.
916-445-2841.
I'm sorry, can
What's the number?
916
445
2841 for the governor. So let's,
Can you put the number in the chat, please? Someone?
it is on the chat right now.
Okay,
And let's put it again.
445.
This is Jessica. I just put it in the chat, and then also I added a sample phone script. Lihia, do you want to read that out maybe?
Yes, I'm gonna read it. So the phone number again is 916 445 2841. And the example that Jessica shared with us says, hello, my name is, I'm California resident and I have a condition or disability and I'm a high risk for COVID. I need to get vaccinated.
Something's wrong with the line.
I'm sorry. The new guidelines to only vaccinate by age leave out people like me. And so you can personalize the message, but you know, this is the idea. So you wanted to get your phone out, and it's again 916-445-2841. Like I said before, this is not a regular Zoom meeting. This is an action. So let's do this.
There is a chance when you dial that phone number, if you follow the prompts, you can record your comment rather than being on hold for a long time waiting to speak with a live person. You can record your comment and add your city as well. And if you know which assembly district you're in or whatever, that would be helpful. But just you can record your message.
So this is Jessica. I'm just going to jump in for a second. I know some people are saying they can't call while listening to us. So Leahy and Russell, can we take 5 minutes and people can turn their volume down and make their call if that works for them? Leahy has given a thumbs up. For folks that feel, I know sometimes it can be intimidating to call the governor's office. Maybe somebody can unmute yourself and make that call in front of us and we can all hear.
Hi, my name is Pilar Cole and I am a person with a disability. And I'm calling because we want equal access to the vaccine centers and we want it now. Yes. We want it now. Equal access to the vaccine centers. Thank you.
Excellent.
They're giving us a lot of complications.
Yay.
We got the message through. They're giving us a lot of complications.
Okay.
Yeah, there is. Thank you, Pilar, for that too. Thank you for sharing that example. If others would like to do the same, let's definitely make space. Just for folks that are doing this for the first time, there is a bit of a phone menu to navigate whenever you first call. First question is whether you'd like to be served in English or Spanish. And then once you navigate through that, you'll hear, I believe it's a prompt that will ask you if you have a comment to make on an issue. And I believe it's, if I remember correctly, option number 6. And then you get the option to either speak to a staff person who's available or leave a message. So feel free to choose the one that you feel is most appropriate. But I'd love to hear from someone else who goes through the process. I just went through myself, was easily able to leave a message. So
I just left a message too. it wasn't
looks
too
like
bad.
we're allowed to do is leave messages.
It may be that some people that are on this call are using the device they would be calling with to do it. And that's my current situation, but I called in a couple of weeks ago about this. So yeah.
I actually called them last week and they said that they've been receiving a high volume of calls and that's why they send you straight to a voicemail. So I guess we're doing it, right?
You can talk to a staff member. You just have to wait online for quite a while. So
Yeah.
I left a message. I left a message last week as well.
Great. This is
I
great.
tried to ask for the staff member, you still getting connected to just the answering machine.
Yeah, but they said that because the high volume of phone calls that they are receiving.
Listen to what I get.
Go ahead.
Oh, I'm sorry. This is Monica. Listen to what I get every time I call. I have a very poor connection.
I did also. Very bad static.
Very bad connection.
Oh.
Because I really want to be able to leave the message. Oh, by the way, everyone. Hi, everyone. I'm here actually. I'm advocating for the entire disability community. I'm very passionate about reducing the disparities within the community. And I have a special need adult daughter that resides in a supported living service, and she has outside 24 care service provider, which puts her at a high risk that she's entitled to receiving this vaccine. So I'm also advocating, in addition, for my mother, who is 81 years old, that doesn't understand the system of how we unable to get the vaccine, although they're saying that we able to get the vaccine. So I'm advocating for the senior citizen community, as well as the entire disability community. And I'm very passionate about that. In addition to, I'm currently an advocate for the Epilepsy Foundation, and I am looking to become an advocate for the Disability Voices United. I submitted my information. That's off topic, but that's why I'm here.
Thank you. Thank you. Thank you for all of you trying to call. And if you cannot call now, maybe you can do it later, but we're going to continue. And we want to make sure that we get to all of our speakers. And we have next Hector Ramirez. Is Hector
Wait.
here?
Leah, last thing. You can email the governor too, and if someone can put it in the chat, some people might be able to do that.
Yes, thank you. Thank you, Sheila. Hector, are you here?
I don't think Hector was able to join us.
Oh, okay.
I think Steve K is ready.
Okay. Can we have MC now? You said MCK?
Let's, so we're still spending some time to call the governor. Curious to see if anyone would like to, maybe we can do one or two people who would like to share their story, what they left on the machine. Does anyone feel comfortable?
I would like to make a comment. Am I being heard?
Yes.
Right, great. My name is Jay Katz. First of all, I just called the governor and all I got was tremendous static, really, really lousy. So I'll try again later. I sent an email last week, and if people have done that, they might notice that there's a pro and con question on the email. Has anybody seen that?
Yeah, those are typically for active legislation. So we're not, this is a little bit different, just FYI, because it's more of a policy.
I was thinking that it was part of these people who count, pro and con,
Right.
They throw it in a bucket, if it's pro, okay, that goes into a good thing that the governor's doing. Con might be a negative.
Right.
And so I asked Peter, is it Yates? Anyway, he answered me, and he said that if you're going to check that box and you disagree with the governor's actions, you should press check off con, because you disagree with what he's doing. You see, it could be taken as pro, you're in favor of the issue, but it is not. It is whether you agree with the governor or not. So, I know I would press and check off con. I'm also worried that if people do this incorrectly, there'll be the count taker might intentionally or unwillingly throw it in the wrong bucket. And I don't want to miscount. That's a whole other story, but I sure don't want one now. So if you do encounter that email, check off, if you disagree with what the governor's doing, as we are, you check con. And I think that's important. I think Jessica, I was looking at the chats, and I think Jessica was asking about asthma being taken off the priority list as far as reasons to get the vaccine. And I read that last week. I noticed asthma was not on that list, but that's the national list does not seem to include asthma.
That is so racist.
I couldn't believe I have asthma, but I was very surprised. It does have COPD and serious lung condition, but I didn't see asthma. So
Thank you, Jay. We need to move on because we have some other speakers.
That's great.
Yeah, just remember that we're all in this together, and that we're asking for equity to be seen in this process. I'd now like to turn this over to Steve K.
Hi, everybody. I'm about to put into the chat a link to the latest, just this morning, release of data from DREDF and UCSF, which I hope people will use to advocate for prioritizing disabled people in vaccination. And Jessica asked me to speak and give a little overview of that. I'm a disability researcher at UCSF, and I'm also on the board of directors of DREDF, Disability Rights Education and Defense Fund. Bear with me while I share my screen. Okay. You should be able to see a slide that says COVID-19 mortality risk for Californians with disabilities receiving IHSS or DDS services. One or two people will say yes to me, please. You can see it. I see Jessica.
Yes, I can see it. And I'm so excited to have you here as another person in the UC system.
Okay, so let me just give you a couple of caveats. Oops, I went too far. So last week we heard that the problem, or some people said the problem with prioritizing disabled people was there was no data. We have, the state and the vaccine commission said we have data on age, but we don't have any data on disability status. So there was a big scramble on the part of my DREDF colleagues and myself, and to respond to this. And as I say, it was a scramble. We did this in a few days. And so it's possible there may be other better data available. Other people could have presented maybe a case that's even more convincing, but I think what we have is fairly good. And normally I would not focus on just service recipients. I would not normally, and neither would DREDF, focus on people, what we're doing, which is focusing on people who are getting IHSS, who are on IHSS, or are service recipients in the California Developmental Disability System. But we decided, we kind of strategized briefly and said, look, if we say to the governor and the Secretary of Health and Human Services that we want everybody with a disability to get vaccinated, they're going to say, well, that's way too many people, and how can we count it? And, how are people, people are going to cheat. And also we said, okay, let's narrow this to a group that basically the state already has lists of such people. So we recognize this is too narrow, but for pragmatic reasons, this is what we chose to do. Okay, so let me start off. I got some data, did some calculations. This is stuff that comes from CDC, Centers for Disease Control and Prevention. I looked at how many Californians who were not living in nursing homes had died of COVID, and I grouped them by age, divided by the population. And here is basically the mortality rate, the number of deaths per 100,000 population by age group. It goes up tremendously. It's actually 0 according to CDC for people under 15, 6.9 per 100,000 for people 15 to 44 years of age, a much higher number, 63.2 per 100,000 for 45 to 64 years of age, 177.5 for 65 to 74, about twice that, 372.9 for 75 to 84, and 885 for people 85 plus. So starting here at the 45 to 64-year-olds, it increases by a factor of 2 or more for each age group. So it's 2.8 times, if you're 65 to 64, you have 2.8 times the mortality risk, the risk of dying of COVID, than if you're in the 45 to 64-year-old group. So I said, well, okay, well, what can we come up with an argument that says people with disabilities have something, 2.8 times the risk, more than that, around that. So we can say, okay, if you have a disability, you're bumped up by one age category. Okay, so that was what we tried to do in this analysis. This is a chart that I put together, which I basically just took the data from a report. If you look in our report that I linked in the comments, you'll see a different version of this chart, and you'll see a link to the original report, which was based on an analysis of health insurance claims. So it's basically people who are getting private health insurance. Then I looked at the risk factors for COVID death among non-elderly people. In this case, they took people less than 70 years old. And this is a chart of what we call odds ratios, which is a weird statistical term that we use, but it basically means the relative mortality risk. So for example, for this first one, if the person had lung cancer, they were roughly 6.7 times at higher risk of dying of COVID than somebody without lung cancer, okay? And I've highlighted in red the ones that I think are particularly relevant for the people we're talking about. So if you have a developmental disability or an intellectual disability, you're around 4 or 5 times more likely to die of COVID than if you don't have one of these things. Alzheimer's is like 3 times. Mobility impairment is around twice just by itself. Dementia, apart from Alzheimer's, is 1.8. And so these range from 6.7 times more likely to die than down to 1.6. And this is just the selected things that this particular study, they looked at selected conditions. They took some out that were not significant predictors, but it's not the list of conditions that we would do if we were doing this analysis. That's not something we can deal with now. There's another table also in that same report, which is really, really complicated. And I tried to simplify it in this chart here, which shows the mortality rates kind of the same as I showed you before. So it's kind of this sort of thing of dividing the number of people who died by the population, except they did it by number of chronic conditions. They call them comorbid conditions. And it's basically chronic health conditions. Again, it's a different list maybe than what you or I would call chronic health conditions. But this is if you have no chronic health conditions, the number they came up with, the mortality rate was 170 per 100,000. If you had 1 chronic condition, it went up to 250. If you had 2, it went up to 330. 3 was 530. 4 was 650. And 5 or more was 1,050. Okay, and that compares with 170 if you have no chronic conditions. And this is for people, again, under age 70. So we have another report, another journal article actually by some colleagues of mine, and they found that people who were getting IHSS in home supportive services had on average around 4 chronic health conditions, okay? So I think we can argue that this is their category, the one in red here, for chronic conditions, which is around 4 times, 3.8 times the mortality risk of people without any chronic conditions. So my conclusion is that if we combine these 2 charts that I've showed you, we can come up with some rather powerful conclusions. Remember, we wanted to say that the mortality risk kind of bumps you up by 1 age group. And I think we can say that IHSS recipients who have about 4 chronic health conditions on average, we got that from one report, have nearly 4 times as high a mortality risk from COVID-19 as people in the same age group without chronic conditions. So that's IHSS recipients. DDS service recipients have, we saw that chart before, between 3.6 and 4.8 times the mortality risk from COVID-19 as people in the same age group without intellectual or developmental disabilities. So this increased risk for mortality puts these 2 groups in a risk category equivalent to other Californians in a higher age group. For example, if you're a service recipient between 45 and 64 years of age, you're at greater mortality risk from COVID-19 than the general community resident population between 65 and 74 years of age. So I think this is a way, when people say, well, we'd like to do this, but we don't have any data available to justify it, I think we can say, no, we've got some data. It may not be perfect, but we've got some data that can justify bumping up these populations, prioritizing people with disabilities for vaccination to be comparable to older age groups. Is Sylvia Yee, has she joined us? If so, Sylvia was going to make a few remarks about the race and ethnicity data that's also included.
Steve, I don't see Sylvia on yet, but can you define DDS, please?
Department of Developmental Services. So if you're getting services from a regional center or you're in a group facility or something, if you get services from California Department of Developmental Services, you're in that category, and that's where we got the data from. So do you want to allow some questions now, or do you want to move on to the next speaker?
Well, one question that was on the chat is that if you can make this PowerPoint available for people.
Yes.
Okay, great. Thank you. So Sylvia's not here? Is there any information that she was going to share that you have some?
I believe she was going to speak a bit to the impact in different ethnic communities. Is that correct, Steve?
Yes. We have some data. If you look in the report from the DREDF website, you'll see that there's some additional data about racial and ethnic distributions of these service recipients. I think it's a huge problem that such a high fraction of people in California who are getting vaccinated are white,
yes,
non-Latino. And so it's also an equity issue that we have a lot of Black and Indigenous people of color who are getting services from either IHSS or Department of Developmental Services. And so we can also argue, I think, on the basis of racial and ethnic equity that this is a population that ought to be targeted.
Yeah.
Thank you. And I really encourage you all to take a look at the report that Steve and his team at DREDF have put together. It is very comprehensive and covers a lot more than the slides have. I know, Steve, that you put the link in the chat a bit ago. Would you like to maybe reshare it one more time? Because sometimes
Sure.
things get a bit buried in conversation. But I did notice and acknowledge that there were a lot of folks saying, different things about different groups, that rare diseases, for example, it's really hard to get data. This is absolutely true. Steve and his team, in my opinion, are doing groundbreaking pioneering work to even look at studying these subsections of our community. And certainly we know that this is not complete, nor does it cover everyone. So what we're saying really is to push and hold the state accountable for the equity principles that they themselves held themselves to, which they're not currently living up to.
Thank you. We do have a question. Sheila, you have your hand up. Do you have a question?
Yes, I was wondering what the sorry, I'm having trouble here. I fixed it. Okay. I was wondering what the proportions are on IHSS or SLS that are in each age group, 1 to 15 and so on. And I would love the data from this chart, and I wish he'd read more of it out. And I would love it sent to me via email, because I would like to share it with everybody and their brother. And I may not be able to really access it myself, but the summary was quite helpful. And I would like to know those, how this stuff pencils out with IHSS especially, but SLS as well, because I think it's really interesting. And is asthma one of the things listed on your stuff or not?
I couldn't hear your last question. Is asthma?
Listed as one of your comorbidities or not?
They didn't include asthma in that study, which I think is really unfortunate.
Yeah, it's very unfortunate.
Diabetes? Did they have diabetes there? Oops, there's another hand too.
Um, I'm sorry, are you answering that, or we can try to see what the question is from Christine, and maybe you can answer both? Christine?
Yes, really quick question. Was cystic fibrosis also looked at?
I have to go look at the original report. It's not listed. Neither diabetes nor cystic fibrosis is listed on their conditions. I mean, I don't think you should take. I don't think the point is not to focus on the particular conditions. I think, but to focus on the fact that chronic health conditions greatly increase the mortality risk. Okay, and I think we can make that claim without relying on the specific. I mean, yes, it's unfortunate that we didn't get to conduct the analysis ourselves and we didn't get to pick the conditions that we wanted to pick. But we have, I think, rather powerful data that says that chronic health conditions in general are really associated with high mortality.
Thank you, Steve. And for those of you that are asking about the data and information, we will be emailing out the presentation as well as additional info to all people who have registered for the webinar. If you did not register for the webinar for whatever reason, you can get in touch with me at disabilityorganizing@cfilc.org. You can send me an email and I can definitely get you the information. If somebody could assist me with putting that in the chat, I'd appreciate it. I'm Russell Rawlings. My email address is disabilityorganizing@cfilc.org, and I'll ensure that you get the all the material from this webinar. And that includes those of you that may be watching on Facebook Live.
Thank you, Rosa. So we might have more questions for Steve, and if you're gonna be with us for a little bit, maybe people can put some questions on the chat and we can continue with our other speakers. Now I would like to, don't we have?
We have a video from Alice Wong. Should I go ahead
Okay.
and play that?
Yes, thank you, Jessica. Yeah.
Yeah, of course. Give me just a moment.
So this video is from Alice Wong, who we are very fortunate to have in the state of California. She is a world-known disability rights influencer and just a social media pioneer, honestly. And this message was recorded specifically for our coalition and our work.
I'm a disabled activist from San Francisco residing in District 9. I have not left my home since March of last year, except once for a flu shot. If I'm infected with COVID-19, I will die. I am not alone in this situation. Like other disabled, chronically ill, and immunocompromised people under 65, being in phase 1C meant we were prioritized to the next round of vaccinations. Everything changed with the governor's announcement this week that will eliminate this phase and scale up with age-based eligibility. Age is not the only factor in determining risk. This decision by the Newsom administration is an act of violence and erasure toward groups disproportionately impacted by the pandemic. It is racist, classist, and ableist. And by the way, there are high-risk disabled people who are essential workers, immigrants, unhoused people, undocumented people, and in communities of color. I am filled with fear for myself and others. I also refuse to defend my humanity and prove my deservingness for the vaccine in comparison to other high-risk groups. High risk is high risk. For more stories about people in phase 1C, check out the hashtag HighRiskCA on Twitter. You can also find me there at SF Direwolf.
Thank you so much for that video. This is why we are here. We want equity. And to follow up social powerful speakers, I would like to have another action right now. Can we all please hold our signs if we have one? And we're gonna be taking pictures. Let's put gallery view.
Oh my gosh, these signs look great. If you don't have a sign, feel free to hold up a fist or whatever works for you.
Right.
And if other folks want to help with screenshots, please do. Sorry, this takes some time. I appreciate you all holding them up. Okay, I think I got everybody.
Thank you, everybody. Did we ever have the other speakers, or we have?
I don't believe Hector is here, but Regina Wallace, I believe, is here.
Can we hear from Regina? Regina, are you here? And you?
Actually, it looks like she might have had to jump off. I'm sorry.
Okay.
Lehia, Russell, do you want to remind us how we should all be taking action while we're hearing from speakers?
Absolutely, yes. So now is the time to send tweets if you are able to do that, Facebook messages. We have our toolkit that you can use. If someone would like to assist me in sharing that link to the toolkit again, I'd appreciate it. This is method number 1. I'll wait for that to pop up in chat, and then I'll move on to, there are essentially 3 ways that you can take action. This is one. This is the way that you can put out some social media messaging. It's really, really powerful. The other is to call the governor directly. Some of you were doing that earlier. I encourage those of you that haven't yet had the chance to continue doing so. If for some reason you're having, I heard a couple of people saying that they were having issues with their cell service. Maybe if you have access to a landline, give that a try. And if not, perhaps Google Voice is a free internet service that you can use to set up, make free phone calls. So I would recommend maybe exploring that website and seeing about setting one up, especially if you have a Google email account. It's really easy. And then finally, you can also send a letter directly to the governor, and there is a link for that as well. And of course, you know, due to the fact that there are so many of us calling, could also be an issue with the governor staff's phone system as well. But my recommendation would be keep trying. And please keep the conversation going. Also, we have heard through the rumor mill that we may get some news tomorrow on this issue. However, we also acknowledge that tomorrow is Groundhog Day. And I don't know how many of you are fans of the film, but in Groundhog Day, the same thing keeps happening over and over again. And because we acknowledge that without any solidified action on equity, that the same things are going to continue happening again and again. And unfortunately, that means that our community is hurting, and our community is honestly, people are dying within our community. So we can't allow that type of Groundhog Day to continue. And we'll be back here again tomorrow at 1 o'clock to encourage more action and also hopefully bring more people into the conversation. And we appreciate it if you could take a moment to like the page Senior and Disability Action on Facebook and watch there for the updates. I will maybe turn it back over to Lihia and Jessica to give the final logistics about how tomorrow will work.
Well, I wanted to say, you know, people were asking about the asthma and the conditions, and not too long ago, when we started to be worried about the care rationing, that COVID just showed it more dramatically, but actually, you know, it's been happening in our communities for a long, long time. So I wanted to say that I feel that there's probably some other stuff that we can do, and we do have a group that is working on care rationing. And so if you want to be part of this group, please feel free to email us with your information, and we can invite you to be part of this group, because this is not going to be something that is going to just go away. We're going to continue fighting for better conditions. This is why we need Medicare for all, right? So we need to make sure that we continue this fight. Sarita, you have your hand up?
Yes, I just wanted to ask a quick question for those of you that represent organizations on if you'd be willing to do a formal letter together to the governor that we signed together to really make our voices heard together as an organization. So yeah, and I put my email in the chat if anyone's interested.
Thank you.
Lihia, can I jump in?
Go ahead.
Sorry, I'm going to try to spotlight myself so people can see me, but I can't figure out how to do it. So that's okay. So this is Jessica with Senior and Disability Action. I want to just extend huge thanks to Lihia and Russell and all of our speakers today. Excuse me, a couple logistical things as far as getting the information for tomorrow. As Russell said, it's Groundhog Day. We're just going to have to do the same thing while they keep doing the same thing to us. And I know there's questions about who to email, where to get certain information. What we are going to do is I will send out an email with follow-up information to anyone who registered, which I believe has to be everyone who's on here. If you If I don't have your email, if you didn't register for some reason, then just send it to me at jessica@sdaction.org. I just put that in the chat as well. Couple other opportunities that I want to be sure people know about. Someone put in the chat that the California Community Vaccine Advisory Committee does meet this Wednesday, and public comment has to be in today, I believe is the deadline for them to read it out on Wednesday. And if folks can stick around for a few minutes, I know I have that information here somewhere. I can find it so that you can make that comment. And then for folks who are in Alameda County, we are doing a town hall on COVID vaccine equity this Thursday night from 6 to 8. And I will put that information in the email in the chat as well. And then lastly, I know there are questions about what do people do in other states or other areas. You know, I don't know that there's an easy answer to that. I think this event was put on by the California Care Rationing Coalition. And so, you know, we're really upset that California has actually been worse than a lot of states in terms of vaccine equity. And so we invite folks from other states to use any of our materials and information and messaging from today as a sample. And I think the more we can all work together across the country, the stronger we will be. And if other folks have ideas or are interested in future collaboration, please get in touch with any of us. Clearly there's a lot of work to do, and we're all gonna be able to do it stronger together. Thank you. Back to Lihia.
Thank you, Jessica. Yeah, you know, Michael Lyons said that's racist when Steve said that asthma is not one of conditions, and it's true. It is racist because, you know, most people that have this condition are Latinx, Black, and other minorities. So that live in very bad conditions, like in the Bayview, for instance, you know, especially here in San Francisco. I mean, like we can see it. So the work that we are doing, you know, with the care rationing might be, you know, reshaping all the time, because the need are like this also. We see when we need to change stuff, and so we go for that. And so maybe we need to advocate for some specific conditions to be included. I don't know what the right answer is, but I know that together we can do it. So please, please, please feel free to contact us. Jessica already gave you her email, and we can connect you with our group, and we're gonna continue to advocate, and we're gonna continue to fight. So let's do it together. Anybody else that wanted to say something to, you know, close this? If not, we can close it now. But, you know, if there is anybody else that wants to say something, you know, that feels that is important that we all know, besides knowing that we need to fight for Medicare for all, which is our next fight. Oh, the chat? Huh? Yeah, we can hear you. Go ahead.
Hi, I was wondering, when we're talking about vaccine equity, has it been addressed the issue that a lot of these current sites are completely inaccessible to people to even get to? In Los Angeles, most of the sites are drive-throughs. You have to have a vehicle. And a lot of our communities do not have vehicles, have no access to them. The sites that are walking, people cannot wait outside for hours and stand. Is that something that's been part of the dialogue that's being put forward?
It has not been part of this work right now, but thank you for bringing it up to us, because actually I heard from some other people before, but I didn't know how bad it was. But I'm gonna invite you to participate in our group. The California the rationing care care rationing, sorry, care rationing coalition. So you can also bring your concerns, and we can talk about what can be done. Is that something that you're interested on doing?
Sorry, I muted myself. Yes, absolutely. Thank you.
Okay, so you got the email for Jessica?
I see a whole bunch of emails in the chat.
Okay, let me put it back. Here. Or Jessica, you wanna write it down and send it back?
I'm setting up the Zoom for tomorrow. If someone else can, my email is jessica@sdaction.org. And Kate just asked about how do we join tomorrow. Things are happening so fast that it wasn't yet set up, but if folks can hang on a second, I will put a link in the chat. And then again, I know the chat is not accessible for everyone, but I will send it out. I will send it out later today.
Can you send out my email as well later today, just in case anyone else wants to get in on the letter writing action?
Yeah, is that Sarita?
Yes, this is Sarita.
Yeah, that sounds great.
Awesome. I'm sending an email to everyone whose email was in the chat that expressed interest, so we can be together.
Wonderful.
All right.
Yeah, if folks have other ideas of how to take action, feel free to put it on the toolkit. You can do as a suggestion, or email us and we can add it. Let's, amplify all of these efforts as much as we can.
And please come to our meetings. I mean, this is great that we having these actions, but we need more people that, bring the concerns that they have in their specific communities, and how we can, advocate all together for a better, more equitable distribution of the vaccines. Is that Jessica, you are working on that link right now?
I am. It's coming in 3, 2, 1. There's the link to it. Oh, wait, that copied strangely. Apologies. Actually, I think it should work. Can somebody try that?
It should work. It should work. I'll try it already.
Forgive, it says cop at the end. That was from copy.
Yeah, but it's working.
Great.
I tried already. Yeah. Okay, so maybe
Should we
anybody
finish with
else
the chant?
Okay. You wanna do it?
No, I want you to do it.
Oh my
Chant.
goodness. So what do we want?
Vaccine equity.
Vaccine equity.
When do we want it?
Now.
What do we want?
Vaccine equity.
And when do we want it?
Now.
Oh,
Hey, love it, Betty. Thank you, everybody. So I guess we're gonna see each other tomorrow, right?
Yes.
All right. I'll see you all tomorrow. Take care.
Bye.
Bye.
Thanks, everybody.
Thank you.
Bye, everybody.
God bless
Thanks for having
you.
me. This was
Thank
awesome.
you for all the information. Thank you.
God bless
Good
you,
to
my
see you all.
spiritual queens.
Thank you.
Have a good day.
Thank you.
Thank you so much.
Thank you.
Appreciate it.